Dr. Ashok Gupta, Professor of Pediatrics, and I head the Rare Disease Initiative of SMS Medical College. This is the first initiative in the country doing this program, and I'm also the chairman of the Association of Rare Disease Doctors. Rare disease is defined by the number of patients, people suffering from the disease, and it is said that if what the World Health Organization defines it as, if you have 10 persons per 10,000 people suffering from a disease, it's said to be rare disease. In India, we still have not had an official definition from any one of the organizations, but one of the organizations which is working in this field, that's the Organization for Rare Disease India, it has proposed that any child or any individual or any patient who suffers from a disease which occurs in 1 in 5,000, it should be considered as a rare disease. And if you look at the number of diseases which qualify to be called as rare disease, it's a very big number. There are 7,000 plus diseases as of date across the world accepted as rare diseases. And because this is a fairly big number, the volume of patients across the world is very big. There are different kind of expectations or different assumptions on the numbers, and it said that there are around 350 million people across the world suffering from some kind of rare disease. And India is no exception, and it's extrapolated to say that we have something like 70 million people suffering from some kind of rare disease or disorder. So it's a fairly common problem when it's pooled together. From the perspective of the volume, India being one of the big populated countries, we certainly have a larger volume of patients suffering from rare disease. Our only problem is that we still do not have a strong registry system to say the number of patients of a disease, how many patients do we have. But at the same time, the number is a big strength from the global perspective, because most places will not have this big number where interventions can be done, where drugs can be delivered, and the cost of therapy can be brought down because of the big numbers. So India is going to be a lead place from the disease perspective, from the research perspective, as well as from the business perspective, as far as the rare diseases go. Rare diseases, what happens is, if you look at the rare diseases, we categorize them into metabolic, genetic, infectious diseases. So we have a large number of subgroups of rare diseases. 80% of the rare diseases are genetic in origin, and 50% of them would manifest with the disease manifestation starting very early in life, that is in the neonatal period. So when I say that how does it affect child, the child is going to be the sufferer because he or she would have the disease. So from the perspective of having a disease and understanding its impact on the child, because the average time that the child to have a disease and make a diagnosis, to have a good diagnosis in this country, has been something like 4 to 6 years. And this is one time when the rare disorder inside his body would damage the brain, the developing brain, the heart and the lungs and the liver and the spleen and kidney and other things, which will devastate in terms of his mental development. So you can have a child who is mentally handicapped, would have epilepsy, would have other neurological dysfunctions, in addition to he or she would have other physical ailments. So the child becomes devastated, the family is devastated, because you are rearing or you are spending your money on bringing up a child who would otherwise been healthy had he been diagnosed early. And the nation also has a bigger burden on, because you are spending money on just trying to maintain these babies' lives, because they may not turn out to be productive at all. You're just sustaining these babies, and so that's a big commitment for the country to sustain. So it's a big burden both to the family as well as the society and to the country to have a child suffering from a rare disease. As the country is growing today, we have treatments available, but not for all rare disorders, and that's true, because we are still in the process of evolution, and it may take time before the major treatments are available. But as of today, we still have information and knowledge that these patients can be treated. And the question is, do we have doctors? Yes, that's one big area or big gap where we still do not have doctors who are really qualified and trained and sensitive enough to make good diagnosis and treatment. It is because for all these years, most of these genetic disorders would be treated with genetics, and genetics are very few in number. though they qualified and competent to make a good diagnosis. But what has happened is down the line, when you have a primary care physician who is not sensitive enough to know that there are treatments available, there is a need for referral, or there is a need for this patient to reach to a different level of treatment. Unless that kind of sensitivity of understanding the abnormal manifestations and referral support, since if it does not happen, the purpose of genetics is getting lost. So we just have a system which needs to really work and move further on that. What I said initially, that yes, we still do not have a formal program to cater to patients suffering from rare disease. The problem is because all these years we've been so focused on mortality and other things that we never thought of quality of life from a medical perspective. And even if you look at our national agenda, we've always been talking of infant mortality, maternal mortality, neonatal mortality. We're just trying to prevent deaths. But as we are now able to control the number of deaths happening across, we are more sensitive towards quality of life, and that is where now our intention or interest is moving towards catering to children with all kinds of disorders to give them a good quality of life. But at the same time, we still, what I said was, we still do not have good programs. One of the first programs has been launched by my medical school, SMS at Jaipur, of training students in the field of rare disease. So this may act as a model to other medical schools, because we have almost 180 or 170 medical schools. So medical schools will have to be the primary focus to bring about change in terms of producing people or doctors sensitive to the issue of rare diseases. There have been major advances in the field of genomics, medical genetics, and things like exome sequencing, gene therapies, and other areas of metabolic screening or metabolic manipulations, proteomics. So many major developments have taken place in helping children with genetic disorders, metabolic disorders, to live a better quality of life. And some of these interventions are now available in the country. Many centers are practicing exome sequencing. Exome sequencing is used for certain rare disorders like muscular dystrophies, and there are very interesting reports that these interventions have produced a tremendous success in terms of giving these children a good quality of life. So you have major advances which are available. Gene therapies are going to be in coming years, and the only thing is, how do we really translate the availability of these advances to the peripheral beneficiary, and wherein I feel that it has to be clubbed with the National Health Delivery Program, because at the end of the day, the success will only come when you have the National Health Delivery System sensitive on diagnosing and on referring these patients at the right time, at the right place. So we need to collaborate with the National Health Delivery Program, as well as sensitize primary care physicians on how to make a diagnosis and how do you interpret the diagnostic reports. When we talk of rare diseases from 5 years from now, it's going to be a much different picture, because the way the genetic therapies or gene therapies and medical genetics is progressing, I believe we will be able to deliver these therapies to a much larger section at a more affordable price, because that's something very important, affordability. That's because one of the biggest limiting factor in the management of rare disease patients is the cost involved. And so what my interest would be to see that the cost goes down, so affordability of the therapy, and because science is advancing, and because I know for many years when we were trying to understand the microarray analysis, the cost has come down drastically. So it's going to be more affordable management at the end of 5 years from now. Yes.